everybody. This is Terry with the Premom team with special guest, again, Dr. Zen, naturopathic doctor who's here to answer your questions live. Anything you have questions about related to fertility. And we have a lot of questions from you. Thank you very much from both Instagram and Facebook. So we're going to start with those questions first. And if we have some time, we'll answer some of your live questions. So take it away, Dr. Zen.
Yay, I'm so excited to be here. Yeah, send us your messages. We are looking at them live. So if you have any questions or maybe something that I talk about kind of triggers another question, feel free to post it in underneath the video so we can see it. We're happy to answer your questions.
All right. Do you want me to answer the questions that you have set up for me, or do you want to just dig in yourself?
Sure. If you want to do the question, if you want to be the host, and then I can, that makes it easier too, then you can kind of tell me what's next. That would be great.
All right. And let's jump in. Your first question is, this person says they're doing IUI right now. The husband's counts have been lower by 5 milliliters each month, 17, 10, 5.5. Why?
Great question. So this is really important because I think we spend so much time talking about fertility in women, but fertility in men is just as important. So for anyone who's unfamiliar with IUI, that's intrauterine insertion. So that is typically done by an REI or a fertility specialist. But one thing we have to remember is sometimes when it comes to getting pregnant, we also have to listen to what the body is saying. And if we're noticing kind of a downward trend that's happening, or we're doing the cycles too close, one every single month, it may be a little too much. So a lot of times maybe men aren't as intuitive with their own body or knowing what is happening, but the stress of having to make a baby, go through these treatments is also stressful on the male. And so sometimes in these cases, I typically say, because some of these procedures are out of pocket, so they're expensive, is take a break, listen to what your partner's body is saying, take a moment to say, okay, what can we do in the next 2 to 3 months? Maybe we need to focus on diet or lifestyle or exercise, or what can we do to connect with each other again that can make a really big difference so that when we do another IUI treatment, we're back to those levels. That alone can make a huge difference. So I know that after all this time of trying to get pregnant, you're like, let's do it again. It didn't work this month, let's go again. And sometimes your fertility doctor kind of pushes that too, like, let's go, let's keep moving. But if we're noticing the decrease in the sperm count, or even the motility or the morphology, so what it looks like, how well they're swimming, it's also important that we look at that. We're not trying to just get you pregnant. We're trying to make sure that you have a good and healthy baby at the end. So that's typically something that I'm really glad someone asked this question, because I get this a lot, where there's this anticipation of, I want to have a baby, let's go, let's go, let's go. And sometimes we have to listen to that, maybe your partner needs a little break, maybe emotionally, maybe physically. That can be really important.
Fantastic. That's a great for me to just plug that we have a panel this Friday on stress and fertility. So
perfect. Yes, definitely check it out. I cannot tell you enough how stress plays a role in fertility. And I know that's the last thing you want to hear is, sometimes doctors will even say it. They'll be like, you just need to calm down and you'll get pregnant, which is like the worst thing to hear. And although that is not what they should be saying to you, stress and cortisol does play a big role in fertility. So definitely check out that discussion, because it's going to be really valuable.
Fantastic. The next question is, long cycles, do they indicate low fertility if they're 50 plus days?
Yes, so this is important as well, understanding your cycle. And this is why Premom can be so valuable. So not only is Premom a great app to really help you understand your cycle, but it actually can help your provider. So you can actually share what's called a provider code with your physician so they can see your readings and what your cycles look like. Potentially, you may have had one really long cycle, but in the past, your cycles were pretty regular. Maybe there was kind of a stressor that was happening in your life, maybe a transition that made that cycle a little bit different. But what is the past history of your cycles? So really focusing on getting that information on Premom, sharing it with your OBGYN. A cycle that's 60 days, that's a long cycle. That means that probably there's a chance you may not be ovulating at all. And that we need ovulation in order to get pregnant. So this is where you can use that data that you're getting from Premom and then bring it to your provider and say, hey, I think something's going on. So this is where, you know, being the active user and using Premom, but again, then sharing that with your provider. If your provider's unfamiliar with Premom, it's really easy for them to set up. It's a free app and they can just add provider code and they add your code in there and they can see everything. It's really, really valuable information so we can understand what is causing that issue. Whether it is a thyroid condition, whether it is a cortisol or stress issue, is there a uterine lining issue, is there an anatomical issue? So this can be really helpful. So if your cycles are longer than 35 days, there is kind of that red flag that should be kind of waved and say, okay, it's time to go talk to my doctor.
I love that. So there's not a one size fits all answer, but it is a red flag, as you said, and it's time to look into all your data.
Yep.
When should you have sex after a positive ovulation test? We get this question a lot.
Great. So Premom actually offers OPKs that actually go and sync with your app. So if you don't know what OPKs are, they're ovulation predictor kits, and they're fabulous. They're at home. They're really easy. They're similar to a pregnancy test. You just pee on them. So that's really valuable. But a lot of times people will be like, okay, what do I do with all this information? Or when am I supposed to have timed intercourse? So what you're going to look for is those levels of LH. So the urine test is actually looking for a hormone called LH, which is luteinizing hormone. It actually comes from the brain and then actually tells your ovaries it's time to ovulate. So typically when you get your highest or peak level, that's going to be the day before ovulation actually takes place. Because remember, it comes from the brain and it has to travel down to kind of give that message to the ovaries. So we typically say within that 24-hour window. So once you get that positive test in that 24-hour window, that's when you kind of want to get a little bit busy and spend that time doing that timed intercourse.
Okay. The next question is, after a miscarriage, how many failed attempts are necessary before consulting a fertility specialist?
Such a good question. So typically in the traditional world, unfortunately, it's 3 miscarriages before an OBGYN will refer you out to a fertility specialist. For me as a naturopathic physician, I think 1 miscarriage is way too many and we should be evaluating right away. Although there can be some genetic abnormalities that happen that miscarriage happened, we want to evaluate what can we do in the beginning stages that we can maybe prevent a future miscarriage from happening. So if you've experienced 1 miscarriage at all or any of those, it's time to go speak with a fertility specialist. And I know that can sound very kind of like almost like a failure. You're like, I can't do this. I need to go speak to a fertility specialist, but they can give you a lot of guidance of maybe they need to do a transvaginal ultrasound to see what's going on. Maybe they can see something directly in your blood work that maybe you haven't noticed before. So getting help from the beginning is going to help you feel more confident and more supported along the process. It's not a straight road to have a baby. I think we're kind of taught in high school, just the thought of sex would get us pregnant. And so when we are finally ready to have a baby and it's not happening, it can feel like a black box. We're like, where do we even start? So getting that support, getting that additional blood work can make a big, big difference.
Okay. The next question is, what can be done to help start your cycle when you know you aren't pregnant?
So first things first, we want to figure out why. What is the root cause? It can depend on when you last finished your birth control, what type of birth control you had. So whether it is a oral birth control, maybe it was an IUD, maybe it was an injection like depot, like a depot shot. Those can vary when you can expect a cycle to return. So the depot shot, for example, even on the label, it says it can take anywhere between 12 and 18 months to get a normal cycle back or that fertility back on track. So that may take a little more time. That's why I'm a big advocate for preconception counseling, so that we know ahead of time what to expect. Because most of the time we think we have to be on birth control until the very last moment until we're ready to have a baby. And then that next month we like wish we were already pregnant. Like it's hard to do that if we don't give ourselves a little bit of time. So that would be the first thing. The next thing is if you haven't talked to your doctor already or haven't had even basic blood work, it doesn't have to be a full hormone panel just yet. Definitely do that. There's a lot of different causes, whether it's thyroid issues again, maybe we need to look at those LH and FSH levels, which are the luteinizing and follicle stimulating hormones. Is the brain even sending the message to the ovaries that needs to happen in order for a period to start? So doing that work is going to be helpful. Also, making sure that you're, again, tracking when you do have a cycle, or maybe you're actually getting just breakthrough bleeding where you're like, is that a period? Is that not? Track it in your Premom app. That can be really valuable so that your physician can have a good idea of, okay, she's actually getting a little bit of bleeding, but it's not a full cycle, or maybe she's getting no cycle whatsoever. The other thing too to remember is if you've already had a baby and maybe you just stopped breastfeeding, it can take a little bit of time. So give your body about 2 to 3 months post discontinuing breastfeeding for your hormones to get back regulated. Prolactin is the main hormone released by the brain to help you with breastfeeding. But once we stop breastfeeding, that level needs to go down in order for our cycle to return. So it really depends on where you are in your life, if it's baby number 1, or maybe it's baby number 2.
Great. How common is secondary infertility? I had a miscarriage after my son and I'm scared to try.
Yes, so I like that this person mentioned secondary infertility because actually in medical terms, secondary infertility doesn't actually mean anything. So secondary is usually based on where it is in your actual body. So there's primary, so the primary issue may be the ovaries, and then secondary can also be something like the brain, for example. So it depends on where the issue is happening. And so that is something that's how we kind of explain secondary versus primary. Is it common for patients to have total luck with their first baby and get pregnant, maybe not even thinking about it, and then baby number 2, things are a little bit harder? Absolutely. Why does this happen? Because we see hormonal fluctuations in different parts of our life. The 3 main places that we see it is during our teenage years, after having a baby, and then during menopause. So if we had a baby and we haven't had our labs evaluated afterwards, this can be a big red flag too. So if you're noticing that it's been longer than 6 months, if you're under 35, or if it's, if it's been longer than a year, and you are under 35 and that, or that it's been 6 months and you're above 35, that's when it's time to say, okay, I need to evaluate, is there something else going on? As a naturopathic doctor, I believe that fertility should be something that we think about as proactive, not reactive. So it should be more about fertility than infertility. So if you're planning to have a baby, get those blood work done, all of that done in advance. That will make a big difference instead of waiting. The traditional waiting period is really based on kind of insurance and a concept that doesn't really make sense. We need to evaluate what we can do now to make a difference. We shouldn't have to wait 6 months or a full year before we make kind of strides towards having a baby.
Can I drink while getting pregnant? I'm worried I'll be less fertile.
I get this question a lot, especially for women who have been trying for 1 year, 2 years, and they're like, is it really going to be that detrimental if I have a glass of wine here or there? This is really a personal question. When it comes to alcohol, you have to evaluate your relationship with alcohol. Are you using it for stress? Are you managing it in the sense of, I have to have a glass when it hits 5 o'clock every single day? Is there that relationship? That can also impact the actual quality of your eggs. So that is something that I always ask patients. If you're having it with, a gathering once in a while, that's okay. Don't overdo it. But if you're kind of noticing, I need to have it, every night, every other night, that is going to impact a little bit that fertility window. So again, it's also understanding what is your relationship, more importantly, to alcohol, and how are you feeling supported during this fertility journey, because it can be difficult. It can be stressful, but are we using alcohol as a form of coping?
Always depends on the circumstances.
It does, but There really isn't, but it's important to make that distinction of being very honest with yourself, because if we follow kind of everyone does the same thing, we already know that if that were the case, everyone would get pregnant in the same amount of time, or everyone would need the same medication. And it's just not the reality. So really evaluating first internal, and that's why I love Premom so much, because it gives you that chance to evaluate, what do your cycles actually look like? What are you experiencing? You can add all of that information in there. So then when you do go to meet with your physician, you have a good understanding of what is normal for you. Most doctors will spend anywhere between 7 to 9 minutes with you. That's really short amount of time. So having your questions already done, understanding what your body is like, because you're the one in your body every single day, not your physician, and understanding too that most of the work actually happens outside of my office. For example, I always tell patients that when they come and see me, I give them the strategy or the guidance that they're looking for, but they have to do the work. And so that can be something that's important too. And that's also important to evaluate your relationship with your physician. Do you feel like you're getting that support? Do you feel like you need to add a naturopathic physician or a fertility specialist to your team to give you that guidance and support and that accountability during this process? It shouldn't be, well, I saw you this time and I'll see you in 6 months if you're still not pregnant. Make sure that you're getting that accountability during that time. I think now, since the pandemic, there's been more and more access to options. Like in Premom, you can do a virtual consult with a physician. You can, meet with a health coach. You can meet with, a nutritionist, all of those things to get that guidance. So I think that can be really helpful as well.
Yeah, and I forgot to mention at the very beginning that Dr. Zen is right in your app. So if you're watching, make sure you check out, go to more and then schedule a consultation. You can find our consultants right in there. And yes, it really sounds like fertility specialists can be like a teacher, like a coach for you, as opposed to, like what you said, a typical medical consultation. They're really that support for you.
Yeah, and everyone's on their journey in such a different way. And so really having that conversation of, do I feel connected? Do I feel supported? Because the process of getting pregnant, going through pregnancy and postpartum is life altering, and everyone's experience is so different. And so some people say, I'm really good. I have a good support system. I have a really supportive partner. And others are like, you know what, I'm kind of doing this by myself and it's getting kind of hard. And that's where we can evaluate, what do you need? What are you specifically looking for? And how can we support you? It's not just about getting pregnant. It's about having that healthy and happy baby. And then for you also to experience a good pregnancy, a good postpartum experience. I think the other thing that we often forget about is postpartum. So during your pregnancy, you're really evaluated, thoroughly, you have your monthly appointments, they're really checking you all the time. You have your baby, and then you have your 6-month follow-up to make sure that you're not bleeding out, which I mean is very important. But then they kind of send you on your way and they're like, well, that's it, enjoy motherhood. And that can feel like you're at the edge of a cliff and you're like, what now? So getting those support systems now during preconception can make you have such a successful postpartum experience, because you already have those guidance and those tools in place. And it can be an app, it could be an actual physical person, it could be a book, whatever those things are. But having those aligned throughout the process, you're not just saying, hey, I didn't do this in the past, and feel like you're always moving forward and kind of have all of this baggage. You're also helping yourself in the future as well.
The preconception visit can really be preparing for trying to conceive, getting pregnant, and then what you're expecting for beyond. Sounds pretty compact.
Absolutely. And it can come in different forms, right? Some patients come in for their preconception appointment and it's one appointment and they've kind of done all the work. They have their Premom information for me. That makes it a lot easier. And then we can go from there. Some patients, we kind of need to create a plan, or maybe they have anxiety or depression and they're worried about their experience during pregnancy and postpartum. And that's where sometimes we need that additional support so that you feel comfortable and you're like, nope, I've got it, or I've got someone on speed dial. I know who to contact or what to do. And that can make a big difference. I think we really need to shift the intention of preconception and fertility, that it's not just medical. There's a mind, body, and spirit component to the entire process. delivering a baby is huge and life-altering, right? And everyone can experience it differently. Some women are like, that was the most beautiful experience ever. Others are like, thank God it's over. Everyone is going to be different. So it's really important to understand your body and take that time during that preconception. And I know that can be challenging because you're like, I wanted to get pregnant yesterday. But my patients that actually do the best and are the most successful are those that do the internal and the external work at the same time.
Fantastic. What about this person says, hi, doc, is it normal if I have, so I think this is similar to the other question, a cycle 63, which means 2 months for a period. I'm not sure if they're saying they have a long period or if they have a long cycle.
I think it's saying that they have a long cycle, but same kind of information I would recommend. So again, if your cycle's over that 35-day mark, again, that should be a red flag in your mind. Premom is really helpful to get organized on knowing what does your cycle look like? Are you getting any breakthrough bleeding? Because if you're experiencing kind of those longer cycles, but experiencing a little bit of breakthrough bleeding, that's a different diagnosis or a different treatment than someone who's like, nope, I haven't had a period at all in 2 months. So again, the more information that you can collect on yourself, the better. So then when you do go and meet with your doctor, and again, I tell my patients this all the time, I actually am going to start sending like a sheet for patients to kind of write down all their questions so that when we're meeting, we're addressing everything. And you can do this with your physician, write things down beforehand and say, okay, I have a question about this, and this. But sometimes when women are experiencing longer cycles, that can mean a variety of different things. Are there thyroid issues? Are there toxin exposures? I think environmental medicine is something that I'm really passionate about because when we're seeing this really steady increase in infertility or patients struggling with fertility, we're noticing that our environment, what we eat, where we live, the water we drink, the stressors that we have, the work that we do, all of those seem to have a bigger impact on our fertility than anything else. And although when it comes to genetic abnormalities, so miscarriages and things like that, many times you'll be surprised to hear your OBGYN say, well, it's your first miscarriage. It was probably a fluke. Just try again. And at that point, that should be a red flag and say, hey, what can I be doing today? And our environment really does make a difference.
Great. All right. Someone wants to know, can you naturally get your progesterone levels higher?
Great question. So progesterone is very important in that luteal phase, or that second half of your cycle. It's really going to help with the lining of your uterine lining, and that will help with implantation. So a lot of patients who experience miscarriages or can't seem to get pregnant, sometimes it's associated with that progesterone. I do want to say not everyone has this issue, and I know it's like a big topic. I see it on social media all the time. Like everyone's like, I need progesterone, which in certain cases is like the magic pill, absolutely, but it's not for everyone. So definitely get your levels checked. I always recommend getting your progesterone levels checked. Let's say you have a normal 28-day cycle, just to make it a little bit easier. You'll want to get your cycle day 21. So I usually do 19 to 21, any of those days. Get your progesterone levels checked. It is super, super easy. You can also do it directly, hopefully soon, in the Premom app directly, because you can actually do it from home. So that's really helpful too. So either one can be helpful, but you really want to evaluate what your progesterone levels look like. So if someone has low progesterone levels, do I need to be on medication? Do I not? Here's what's really important. Progesterone is part of a big cascade of your endocrine or hormonal system, and all of your hormones go in play together. Specifically cortisol, so that's that hormone released when you have stress. And this doesn't mean that you have to live a super exhausting, stressful life. Think of exercise. Exercise is a stress, but sometimes for certain patients who are doing too much high intensity workouts, or not sleeping enough, or that's kind of affecting, or maybe their thyroid's off and that's also affecting their cortisol. Cortisol can be adjusted by many different things. However, if cortisol is an issue or there's something going on, your body wants to keep up with demands. And one of the ways it does that, it can steal from other hormones. one of the favorite hormones that cortisol likes to steal from, or the adrenal glands like to steal from, is progesterone. So where is the root cause of why is your progesterone levels low? Is there something else in the cascade going on that's causing that discrepancy? Are your estrogen levels way too high, and that's the reason your progesterone levels look low, is because you have way too much progesterone? Then we need to address that aspect of it as well. So understanding those different components can make a big difference. As to, can I take a supplement? Can I eat a lot of wild yams to get progesterone? So bioidentical progesterone, which is typically prescribed by your doctor, it can actually be done through a compounding pharmacy, which I personally love because we can give it in different forms. So whether it's a vaginal insertion, we can do it orally, we can do it as creams. I'm not a huge fan of creams just because we seem to not be able to absorb it very well, and we share it with our partners. So I don't like personally using that, something that's a little bit easier. But again, it can be given in different forms. The reason progesterone or bioidentical progesterone is different from, let's say, wild yams is although progesterone in the bioidentical form is natural, it first needed to be derived in a lab, comes from a plant typically, so yams is one of them, or if you're doing estrogen, it comes from soy. So it still comes from a natural source. However, it needs to be rearranged a little bit, the chemical structure in a lab, in order for our body to absorb it in the right way. So when patients have low progesterone levels, typically I am going to prescribe a bioidentical progesterone, but I'm also evaluating all the other aspects of their endocrine system to determine where else can we make adjustments so that their body isn't kind of taking from that progesterone. Because if we give progesterone and then your cortisol levels are through the roof, your body's like, great, thanks for the extra that I needed. And those levels don't really, go to the way that they should. So progesterone progesterone as a capsule or as a medication can be very, very valuable, but getting to that root cause is going to be more valuable in the long term. You also might experience a little bit of breakthrough bleeding when you start bioidentical progesterone. Know that this is normal. It happens typically for certain patients, like the first couple of days that they take it. Always talk to your doctor if you're experiencing a little bit of breakthrough bleeding. But if you've never, if you've had really long periods, or anyone struggling with fertility, the minute they see even like the dot of blood, they're like, oh my gosh, this is so frustrating. Just hold tight. Just know that sometimes that happens. But again, talk to your doctor. But that is something that patients are like, it's not working. I don't know what I'm doing. It's normal for that period sometimes to happen, a little bit of breakthrough bleeding. But again, if you have any questions, send a message to your doctor's office. There's either a medical assistant, a nurse, or the doctor themselves that can kind of coach you through that and make a note about that so that we can evaluate what that looks like.
Okay, and we have a question about when to make an appointment with an OBGYN after a year of TTC and recent loss. I'm guessing you're going to say as soon as possible, or at least to talk to somebody.
Yes, right now. Yes, make that appointment right now. Typically, I always recommend, if you're wanting to have a baby, even the thought of it, go meet with your doctor. We really want to take that preconception and make it more of a staple in standard medicine. I think this is really important. But if you're experiencing any kind of loss, and even if you are, and now that you have been trying for a year, you've met those marks for even insurance purposes. So depending on your insurance plan, some, physicians will be like, wait 6 months, wait, a year. Again, if you don't feel like you're getting the care that you deserve, go ask someone else. Go meet with another specialist. Do those things. Don't feel like you have to just be complacent and be like, okay, well, I guess I just have to wait. If there's something that you feel doesn't fit or doesn't feel right to you, listen to your gut. This can make such a difference for so many patients.
We have a question about smoking. Will quitting smoking improve sperm count?
Absolutely. So think about smoking as not just affecting the lungs, which we think of most commonly, but it's also affecting all the vasculature in our body. What's a place that needs a lot of blood flow? Well, let's think a little bit below the belt. And that's really important when it comes to semen production. So again, when we do a semen analysis, we're looking at different values. We're looking at morphology, how the little swimmers look. We're looking at their motility, how fast are they swimming? We're looking at the shape and the concentration. So we're looking at different values of what that looks like. We've noticed with smoking, sometimes there's enough sperm production, but maybe they're just not swimming very well, or maybe they kind of look a little abnormal. Think of smoking also as an oxygen species. It's called a radical oxygen species. So this is something that causes oxidative stress. So that may sound, you might be like, what the heck does that mean? Think about when we notice like a little bit of change in a car, like the rust on a car. We know what oxidation does. Similarly, that happens in our body. So when we smoke, we cause kind of that deterioration of our cells, and this also can affect our sperm. So if your partner is smoking and you are trying to conceive and are struggling to conceive, this can be huge. Also, if they are smoking around you, it can also impact your health and your ovarian reserve and your eggs. So this can be something that I always start with. Stop smoking. And I know it's not easy and it's an addiction. And, you know, the way that they make cigarettes makes it very addicting. But taking that time before you spend tons of money on IVF treatments or doing further, treatment, focus on what you know. We know that, smoking isn't good for us. And start there. I know that can be hard and you're like, wow, I don't know if I can have my partner stop. That's when you have to have an honest conversation with them and say, are we on the same page? Are we kind of looking for the same outlets? And he may actually be using smoking as a stress mechanism because he's concerned about the fact that you guys aren't getting pregnant, right? Have those conversations so you can help also align with them. Do not, if you go up to them and say, you need to stop smoking, you're the reason we're not getting pregnant. Well, that's not going to be very helpful and very positive. Be in there and understand maybe their struggle and say, hey, it would be really important for our future if we stop this smoking. What can we do to get there? Do we need to talk to a physician to help us during that process? Do we need to talk to a therapist? Do we need, supplement support? Do we need to talk to a nutritionist? What do we need to do in order to make that happen? Make it a positive experience and be supportive, just like you would want him to be supportive instead of saying, oh, look, you got your period again. Like it's your fault we're not pregnant. You would be like devastated. And the same has to be true in the reverse. Having that compassion for your partner in together, which in a very stressful situation can be hard sometimes, but make that effort because you would want it in the reverse, but also them just understanding that, okay, this is a problem, but they're willing to be there. You're going to help them do it and stop smoking so much faster. You'll be surprised.
Thank you. That was a very thorough explanation. And then before you explain why we say not to smoke, let's see. We got a couple questions about semen analysis and how to get that checked.
Yes. So this is a great question. So whenever I see patients, I typically like to see them actually as a partner because it takes two to tango. And too often we as women feel like we have to take this burden of fertility on our own and we have to just travel this journey all on our own until we actually at the end really have to have our partner involved. The sooner you guys can be on the same page, the better. So when you're getting hormone testing, if you can have your partner get their semen analysis done, the better. That, we can kind of look at all of the values at that point and evaluate from there instead of going through treatment or, going month after month being like, oh, it has to be me. It has to be me. Just do it at the same time at the same page. There are different ways of doing semen analysis. So there's at-home kits that you can do, and they can give you a kind of a rough idea of where your levels look, which can be helpful, especially if your husband partner is like, heck no, am I going to a clinic where I have to do that, in a room? I understand that can be a little bit uncomfortable. I think men forget that women have to do well woman exams every year, so they have no idea what they have to go through. The other option too is there's plenty of fertility clinics that actually you can call them and say, hey, I'm not a patient yet, but I would like my husband to, or my partner to complete a semen analysis. Do you offer cash pay options? And most clinics do. So you actually don't have to be a patient or have to go through everything to get that. So sometimes it can be covered by insurance. You can ask the clinic, or sometimes there is a cash pay price. Typically, I mean, I'm here in Arizona. Some of our fertility clinics do cash pay options. And usually a semen analysis can be anywhere between $100 and $200. So anywhere between there. A lot of our clinics here, they're great because actually you can go pick up the collection tube and your partner can do it from home, and they just have to bring it back to the clinic in a certain amount of time after collection. So there's no more need to have to do it in an office. I know we have seen it on too many movies where there's that awkward moment where there has to be a TV or a magazine and it has to be like uncomfortable. Things have really advanced since then. So don't be afraid to ask your partner and say, hey, I am doing everything I can do. I'm working on my health. I am doing the hormone testing. It would really mean a lot to me if you can do that semen analysis. So a lot of people think like, oh, I have to go through the hoops to get a semen analysis. There's a lot of different ways and it can be a lot more affordable than you think.
Great. Let's see, and I wanted to just I saw we had a question about supplementation, and we just had a whole video on that. So I'm going to recommend that you go back, and I think it was just the last one. So go back and check our last spotlight. Let's see. We also had a question about reasons for miscarriage. Could aspirin, progesterone, prednisone, LDN, any of those be a factor?
Yes. Okay. So I think the question was the patient has had recurrent miscarriages and that's what they're on. They're on the progesterone, the low dose naltrexone, all of those things. What can they do next? I think, again, that environmental piece is really missed when it comes to traditional medicine. So although I like to think of medication, they can be really helpful. But again, think of birth control. When we were on birth control, most of us actually didn't go on it for contraceptive reasons when we started in our teenage years. Maybe it was irregular cycles, maybe it was acne, maybe it was, emotional support. There's a lot of different reasons people were put on birth control in the first place. But it kind of acts like a mask, right? It doesn't really get to what's actually going on, but it's just kind of tweaking or temporarily fixing or putting a Band-Aid and not really helping that process. So the same is true when it comes to recurrent miscarriages. We want to make sure that genetically everything looks good. Potentially if you have had recurrent miscarriages, you're probably seeing an REI who is doing some genetic testing. Maybe they did genetic testing on your previous loss, which can be super valuable information. I know this can be a painful experience when you're already going through this, that your doctor's like, hey, can we test or do a sample? And you're like, oh my gosh, I don't know why. I don't know what to do. It can give us a lot of information of where to look next. Once you are on the progesterone, we have to also check that it's working. So I always recommend that you, again, that next month, so let's say you started, let's say in December, in January, go and get your blood work done or ask your doctor, hey, can you repeat my progesterone levels? Make sure I'm actually absorbing it and that it's working. So this is something that can be also helpful because whether we use supplements or medications, we need to make sure that what we're doing or what treatment we're offering is actually working. And this is where doing the additional blood work, doing it again can make a big difference. Again, progesterone testing can be really inexpensive, even on a cash pay level, even if you get it in your blood or a serum test. It's some labs do it for like $30, $40. It's really something that's very easy to do. So make sure that you're evaluating that. Another big thing that I always ask with patients who have had recurrent miscarriages or who have had even just one loss is, what did your thyroid panel look like? The one big thing that we look at in traditional medicine would be thyroid stimulating hormone or TSH, but the range is usually 0.5 to 4.5. That's a really big range. Unfortunately, what we have seen in recurrent miscarriages in research is that even patients that are considered within normal range, so within that 4.5, that patients that actually had a level that was higher than 2.5 had an increased risk of developing a miscarriage or undergoing a miscarriage, which means that really our optimal range should be 2.5 or lower. So look back at your results and say, hey, maybe that's something I need to investigate. The other important part of thyroid function is making sure that your doctor actually checked your thyroid antibodies. So TSH, which is kind of the marker that a lot of doctors do on a regular basis, that gives us kind of a snapshot image of your thyroid, but it's actually a hormone released from the brain telling the thyroid what to do. However, how is your thyroid actually responding to that response? So that's where we're actually checking the hormone levels themselves. So we typically check free T3, free T4. Those are going to be really important and valuable in that information. You can also check what's called reverse T3, and that can be really helpful for an environmental aspect. So we like to think of the thyroid as kind of the yellow canary. So typically the yellow canary when you were in a mine back in the day was kind of the alert system of the mines, like, hey, something is wrong. We need to do something. There's something in the environment that you're not sensing, but I can sense. The same is true with the thyroid when it comes to environmental toxins. So if we notice that our thyroid isn't functioning correctly and we're like, everything else looks normal, I can't figure out what's going on, that's where that environmental component looks like. And a lot of patients will say, okay, what do I do if I want to look at my environment? What do I need to do? So there's different forms of testing. I typically do a questionnaire to kind of figure out your lifestyle, where you live, all of those things, because those also play a big role in what testing we need to do. There's heavy metals. So are you exposed? Are you an organic chemist? I knew someone who was an organic chemist and she was exposed all the time and didn't even put 2 to 2 or, together and say, hey, that could sometimes be affecting my body. Maybe you live near a golf course. So I recently talked on Instagram about glyphosate. So glyphosate is the common pesticide commonly seen in Roundup, and it's everywhere, like literally everywhere. It's kind of a little bit scary to think that if you Google where you'll find glyphosate the most, one of the highest numbers is Cheerios, which we give to our children all the time, which is terrifying. So glyphosate is everywhere. It's sprayed on just about everything. So really focusing on where you live. And one of the reasons I always ask where you live is if you live by a golf course, a lot of times they're spraying a lot with Roundup. So if you're exposed every day, that can be something that we need to evaluate. The other thing to think about when it comes to glyphosate is it is often sprayed on commercial cotton, which you can think, okay, my clothing may be something to think about, but don't forget about tampons. So commercial tampons are typically sprayed with glyphosate. So we are now putting a chemical that has been documented to cause endocrine issues in one of the most sensitive places in our human body. So another thing that you can do is look at your environment, make a list of the things that you do every single day, and evaluate maybe these are areas of environmental exposure. If you're like, I don't want to go through that, I just want to know what is going on and how to fix it, there are tests to do that. So we usually use one that evaluates both blood and urine because we're looking at how you detox, how you are able to eliminate, as well as what your active levels are. So that can be helpful as well. But environmental medicine is a booming field in fertility in the naturopathic community. It's something that I am super passionate about. And I think it is really the missing link to a lot of patients who have been told they are just experiencing kind of this unexplained infertility. All tests look normal, but you're infertile and we don't know why. That's where we need to kind of do a little bit more investigating.
There is an explanation.
Yes, exactly. But that glyphosate like blew my mind. Like when I looked at it, I was like, Cheerios? Like we give this to our children. It's crazy.
We had a question about touching on what I just lost my screen, but it was POF. And I know I had to ask you what that was. Can you talk a little bit about POF?
Sure. So primary ovarian failure. So this is kind of when menopause happens early. So early menopause. So in patients that are, and this can happen at any age really. And so this is where checking your FSH and LH levels. You can do an ovulation predictor kit to start and see how your positive levels of luteinizing hormone are happening. If you're not experiencing those positive readings, which may mean you're not ovulating, that's where, again, talking to your doctor so they can run these two tests. So the reason these two hormones, which come from the brain, are so important is they're really talking and communicating with your ovaries. And what happens with primary or premature ovarian failure really is that now the brain is sending signal to the ovaries, but maybe the ovaries aren't functioning the way that they should. And their level of hormones like estrogen and progesterone are starting to decrease because they are actually starting to become in that menopausal section. What happens, and we can see it in blood work really easily, is that your FSH level, so remember it comes from the brain, will be like screaming at your ovaries, like, hello, I'll send you more signal. Like, can we make this happen? Can we work? Like, can we create estrogen? Can we create progesterone? And you'll notice your FSH levels will start to increase. You'd think they would decrease, like, hey, I'm going through menopause, but it's the opposite. Because remember, it's the brain that's trying to talk to the ovaries and it's just not working. The ovaries are like, no more. So the level that we look for in patients that experience this premature ovarian failure is really an FSH above 40. So you'll notice if you're in menopause, what will happen is those levels will start to like really increase. You'll start to notice like 70, 80, and you're like, okay, we are in menopause. That's how your doctor can tell you that you're in menopause. But what we notice in kind of that premature ovarian failure is that FSH will get close to that 40. And that's where we're saying, okay, now we're noticing the problem is really that the ovaries aren't functioning correctly and we're starting to get into that menopausal section. And so treatment may look a lot different depending on the fertility specialist. They may say, you know, IVF is great, but if we don't have good ovarian reserve, if we don't know if the ovaries will respond, it's not worth it. The other thing I want to mention with IVF, because I know we're bombarded, and every time I watch TV, I want to like scream at the TV because I think there's so many myths about fertility and about IVF where women are kind of thinking, okay, I've hit 40, so now I should get IVF, or I can freeze my eggs when I'm 40 and I'm going to get pregnant, no problem. I have all of that time in my 30s to wait. Or maybe, you know, I want to try naturally and if I won't even go to a fertility specialist to even ask what I need to do, but I know at 40, like worst case, I can do IVF. The truth is, and the studies show that your chance of a successful pregnancy at 40 years old, depending on, you know, there can be other circumstances, but in general, your chances of a successful pregnancy naturally versus IVF is the exact same. And I know that's shocking to think about, but that means that we need to evaluate and do more work in that preconception time. That's what's going to make the biggest difference. Doesn't mean that women in their, you know, in their 40s don't do IVF and have a successful pregnancy. But if you're meeting with your fertility specialist, ask that question. What are my chances? What are my odds? How does that compare to natural fertility? Because you might be surprised. And in some clinics, and these are, I love working with fertility clinics that really give this information out freely and are honest about it. Because sometimes, again, fertility treatments are very expensive and some doctors are like, let's just try it. We'll see how it goes. But we want to be realistic of where should we be focusing our financial, mind, our mental and emotional support. That doesn't mean at 40. And I know one of the questions was, if I'm 40, is it possible to still get pregnant naturally? Absolutely. Do we have to do a little more work? Yep, we probably do. Do we have to really take that environmental part and component of it seriously and our diet seriously? 100%. It's not impossible, but we have to be willing to do the work. So when I talk to patients, we do a discovery call, or you can do it through the app. We always want to discuss, where's your mindset in this process? Where are you feeling comfortable? So we can have an idea of where we need to target our information, our time, our money, our finances, all of those things, so that you can have a healthy and happy baby. So I know that was like a long answer, but I wanted to cover a couple things.
Yeah, that was really helpful, and you did touch on some other things. Thank you. I know we're almost out of time, so I'm just going to do a quick speed round and grab some live questions now.
Perfect.
Actually, we did have one more question about chasteberry. Any thoughts on chasteberry?
Yes, chasteberry or Vitex is a super helpful herbal treatment that can be helpful actually in patients who have irregular cycles. That being said, again, if we aren't addressing why you have irregular cycles, let's say it's a thyroid issue, all the chasteberry in the world is not going to make a difference because we're not addressing the root cause. But yes, chasteberry and Vitex is super powerful. I love using it, especially in patients who have PCOS. It can be so tremendously helpful, but doing it the right way, there is a magic touch to it to make it work.
Okay, and kind of a follow-up, thoughts on using baby aspirin during TT?
Yes. So one of the important aspects of fertility and preconception is we want to make sure that we are really evaluating the patient as a whole. So one of the things that many fertility clinics will actually do is put a patient on baby aspirin. It's very similar. So baby aspirin is kind of like a blood thinner. So it kind of can reduce your risk of clot and clot formation. So when we are giving hormones, there is a risk associated with giving hormones. So for example, even if you think about birth control, patients, a lot of patients are on birth control, way past 35. But if you actually read the label, it says that if you are above 35, your chances or increased risk of having a heart attack or a blood clot is much higher. And why is that? We're noticing that at that age, we're noticing that hormones impact our health differently. So many patients, as a precaution, are put on baby aspirin to help avoid this risk, so that if they are given hormones, that they aren't increasing their risk in other areas. Another natural treatment that can do similar things to birth control, or to baby aspirin, is fish oil. And that can be in a form of an oil that you take as a capsule. It also can be something that you take in your diet, whether it's wild caught salmon or increasing your omega-3 and omega-6 fatty acids. So things like nuts and seeds, avocados, all of those things can be beneficial. That being said, don't just take a baby aspirin or a fish oil without first talking to your doctor, because if you already have thin blood, or if you have low platelets, or if you have easy bruising, do not add something that can actually make your symptoms worse. Always, always, always consult with your doctor and be honest with what you are taking. This is extremely important, especially if you're having any kind of medical treatment at all. I have now surgeons and their surgical team will tell you and say, are you taking fish oil? Remember what you're taking, because it can make a big difference in the surgery room if anything is necessary. So again, fish oil can be very, very beneficial. Baby aspirin can be helpful as well. Is there one that's better than the other? I think the verdict is still out. I think definitely having a complete omega-3 oil like fish oil gives your body other micronutrients that is very helpful in kind of that ovarian reserve part of it, which is something I know we talk about a lot in preconception. How can we stimulate or support that aspect? So I would say that would be something to look at.
Great. And thank you. Unfortunately, that's all the time we have for today, but we are so happy to have had you today with us, Dr. Zen. Thank you for answering all of those questions. And thank you to all of those out there who participated and asked questions in advance, and also who joined us live and participated with us here. We enjoyed your questions and comments and answered as many as we could, and we'll see you again next time. Also, make sure to check out our consultants in the Premom app. You can find Dr. Zen right in your app if you go to More and schedule a consultation for that personalized service we were talking about today. Take care now.